Hi, good afternoon. Welcome back to CV, Sisterhood in Surgery. I'm here, Linda with my co-host Palma Shaw in Upstate New York. And our guests today are cardiac surgeons, Tom, we call Tom McG, from here. Then we have Ourania Preventza at Baylor across the street and Meekyong Kim at University of Michigan. So everybody welcome.
Hi, Linda. Hi, everybody. Hi, Palma, Ourania, Karen.
Hi, Tom.
Hello.
And everybody out watching. I think...
We do take questions during the show. We like the audience to be involved.
Yeah, so for those of you watching, joined by the web, you can go to polev.com and enter DEBAKEY, D-E-B-A-K-E-Y, or you can join by text. If you text DEBAKEY, D-E-B-A-K-E-Y, to 37607. Would love to hear from you. Love to get your questions.
Thanks, Tom.
Happy to answer them.
So today we're here to discuss, cardiothoracic surgery, and the focus is on how we increase the number of women who are considered entering the field. And so I know, Tom, and you and I have talked about the numbers, and 6.5% of how many total physicians, like 3,000, are women, which then 80% of those are thoracic, which leaves cardiac surgery about 20%, and so that's around 30 people. So that, again, those numbers are slim. And so the majority, like you said, are thoracic surgeons about 80%. Why do you think there is that discrepancy?
Well, I think there's a lot of history behind it. I think that historically, fewer women, when I was in medical school, even though half of my class were women, very few of the women were interested in going into surgery for reasons I don't know. And then, and of the women that went into surgery, even fewer of them were interested in going into cardiothoracic surgery. I think there's a lot of urban legend behind it. I would say that the tales that were told about cardiothoracic surgery back in the old days being a carnivorous, hard, rugged training program, I think were not completely true, but they were somewhat true.
Yeah.
And I think the training paradigms were very difficult to have work-life balance. And I think that certainly in cardiothoracic surgery, we understand that, we know that, and we want to change that. Particularly, we want to change not just the perception, but the reality that we want to be a specialty that is attractive to everybody. And the reason for that is, I mean, no offense to Linda and to Palma, cardiothoracic surgery is the best specialty in medicine. Easy. I mean, it's the best.
Yeah. And Ourania, Karen, any comments on that, saying it's the best? I mean, I'm assuming you both agree because you both are successful cardiac surgeons.
Yeah, of course.
When I was in training, it was the only thing that I didn't want to leave the hospital for. I just wanted to see more of it, do more of it, and I couldn't think of doing anything else.
And it's really, I mean, cardiac surgery is as hands-on as a specialty, can get. And really, people going to it, they like to work with their hands. They like to adapt to any unpredictable events. You can see physiology in action. The heart is beating, you see the problem, you fix it, and then afterwards the heart is beating even better. So it's an amazing field. Back though to just to make a comment to your original question and to Tom's to a little add to Tom's comments regarding cardiac surgery and thoracic within the field of cardiothoracic surgery. I think the things don't happen by serendipity, And women in thoracic surgery within our field, traditionally, we have pioneers in thoracic surgery. We have Leslie Coman. She founded the Women in Thoracic Surgery. That is really our organization, which includes women who practice in cardiac surgery, thoracic surgery, and congenital surgery. We had the late Caroline Reed. We had Caroline Dressler. We had Valérie Rouge, you know, the current president, the prior president of the American College of Surgeons. So we really had pioneer women with high visibility in the field of thoracic surgery who really advanced, you know, the lung cancer treatments and esophageal disease. At the same time, we didn't have the same visibility or the opportunities for women on the cardiac surgery domain. As a result, due to lack of this visibility, today, most of the women in the cardiothoracic field follow really the field of thoracic surgery and not so much the cardiac surgery. So really the lack of mentorship and the visible role models, because maybe at least what I contribute today, that's adult cardiac surgery, is not where thoracic is.
Oh, I think that's right.
The two specialties, oh, sorry, go ahead.
No, go ahead,
I just
Karen.
want to counter Tom's comment there about vascular surgery and CT surgery. I agree with you. You know, when I finished training 17 years ago, and if I had someone like Ourania that I could look up to, like I now work with Leslie Coleman, and I look up to her, and I said, I can do that. I'm a woman, I can do that, or maybe I can have a family and I can do that. I would be a heart surgeon right now. I would be doing hearts, and I'd be standing there with these women, the 30.
Palma, don't betray us, my gosh.
I'm just being honest. I have to be honest and speak the truth. I love cardiothoracic surgery, and I think there's nothing more incredible than opening that chest and fixing that heart and saving that life, and it's incredible. And I really am so happy, Tom, that you had asked us to host this, and these beautiful women here who I know are going to be incredible role models for all the women that are watching the show and are going to watch the show later on YouTube when the word gets out, because I think that we need more women in cardiac surgery. They offer something different, just like we've offered something different to vascular surgery. So I applaud you all for this.
So Palma, I couldn't agree with you more. So when I started my internship in surgery, literally the last thing I wanted to be was a heart surgeon. I mean,
Really?
Honest to God. And I didn't know much about general thoracic surgery. When I was a medical student, you know, my understanding of cardiac surgery was I thought it was boring. I thought cardiac surgeons did, you know, alphabet surgery. They did AVRs, they did MVRs, they did, you know, cabbages. When I became a resident, and number one, I saw what cardiothoracic surgery was, what they could do. I mean, I was fascinated by it. But more importantly, the role models that I had, the residents, the attendings, and just how amazing they were as role models. I wanted to be like them. And I think that when I look and I see Ourania and I see Karen and I see other women who are in cardiothoracic surgery, I mean, they are tremendous role models for everyone, men and women. And I think that, I do think that role models are important. I do think that the more women, the more underrepresented minorities we have in each specialty, the more people will realize this is a specialty where I can be successful and I can be happy doing this for my life. You know, and I think that's where it starts. There certainly are practical and logistical problems that are, you know, part of the training programs. And I think vascular surgery made the leap before cardiothoracic surgery did. And I think that we in cardiothoracic surgery are learning from the paradigms that happened in vascular surgery.
Karen, you were going to say something?
Yeah, I think the two specialties are different. They're related but different. and that may play into it. But as others have mentioned, exposure, having a mentor, a role model, someone who encourages you. I didn't know if I could be a heart surgeon when I was a resident. I wanted to be, but and I was a general surgery resident at Mass General under Tom, and he said, absolutely you can. And just having somebody tell you that when you're not sure yourself, I mean, it's amazing. So I think having young women come through as medical students, residents, people having people that they can look to, whether it's men or women, is important.
Have you felt that there have been barriers preventing women, or really in your personal experience, from entering the specialty? Did you get any pushback as y'all went through your training?
Well, I heard things like cardiac surgery is going away. There's PCI, there's TAVR, there's not going to be any jobs. I think we all know that that's not true. There's plenty of surgery to go around for everybody, and plenty of procedures. So I never felt that I couldn't do it, like technically or clinically, like in terms of my hands or my mind. I think there were some people who thought, well, what about the hours, your life? Gosh, when you're a resident, you're just enraptured by what you see and what you get to do. But it's still worked out just fine.
I think there are always, people that, they can push you back, or they have like different ideas from what, you have. But to have, perseverance to follow your dreams is very important. Is usually what we call, and I think Palma can see that, is like what we call the blue ocean strategy. Basically, you make the competition irrelevant and you make the people pushing you back irrelevant. Is really what it matters, is really what you believe and what you want to do and what the dreams that you want to pursue. And there is always opportunities, no matter what the other people think. So following your dreams, having a very supportive family, and really know what you want to do, and having the appropriate role models is very important. I think I want to go into the mentorship again, because it's really is crucial. And I was reading a recent article actually around regarding the experience of female surgeons around the world, regardless on geography, national income, and cultural, gender inequalities. And universally, they said that what really they miss, and the major barrier in advancement, as well as why women don't go into surgery, was really a lack of mentorship and a lack of role models. And that was universal, regardless if the women were in the US, in the UK, rest of Europe, or in Asia, or in underdeveloped ethnic countries. So what actually this tells you is that how early on to have mentors, and mentors can come in different, gender, racial, race or ethnicity, and different size and shapes, as I say, but you do need to see them on the podium. I do need to see Karen on the podium, and I need to see her present, having leadership positions, because this is how I know that I can do it. You cannot be what you cannot see. And this is, I think, we usually say that all the time, but it's absolutely correct. And is extremely important for all of us, and especially leadership, if they really want to attract the best and the brightest, all of us really to make a conscious effort and decision to make this happen. This is not going to happen by serendipity. It's not going to happen If we wait for this to happen, it's going to be 2130, as they say. Like, in order to see women professors in academic medicine, you need to wait until 2130. Okay, I think 2130 most likely we'll be dead by then. But if we want to see it any earlier, really we have to make very conscious efforts to make this happen.
Ourania,
Definitely.
In our last millennials session that we had, our millennials on the show said that this is important to start even really young, like in college. Is there a way that the cardiac programs can appeal to college students or engage them even before medical school? I mean, this is the feedback that we got in our last show. Do you have any?
I think it's very important currently with the societies, and I think Tom can talk about this, but our societies, they actually target medical students, not so much college, but they do target very heavily medical students with various scholarships, various programs for their future, looking to the future scholarship, member of a day or inter-scholarship. So we do have various programs. But regarding college, actually I agree with that. But we don't have yet really programs in place that target college students, at least to my knowledge. But definitely we target very heavily medical students.
That's absolutely right. As Ourania said, certainly the Society of Thoracic Surgeons has a Look into the Future program. And what we do, both at our annual meeting, which is this year virtual, but in the past, we have a program where we will fly medical students or residents to the meeting. We'll put them up in a hotel. We will pair them with a mentor to go through the meeting. We also have a program along with the American College of Surgeons. We're at the annual meeting for the ACS to do the same thing. We actually have a lab where there's suturing, there's putting in aortic valves, there's deploying TAVR valves, doing different kinds of thoracic procedures that is open to residents, medical students, and college students should they want to participate. But Palma, you're absolutely right. I mean, we have to go deeper and deeper into the schools at the college level to get people interested in it. You're absolutely right.
Maybe even earlier too. At the University of Michigan, we have an organization called Doctors of Tomorrow, where medical students and faculty work with high school students, and they get them interested in medicine. Those students then matriculate at the University of Michigan and continue on. So, but the pipeline can go all the way back. And I just like to say that I remember when I went to my first Society of Thoracic Surgeons meeting, and I saw Ourania up there as the only woman amongst a huge group of men talking about aortic surgery. And I vividly recall seeing her up there and thinking, oh my gosh, maybe I can be up there too one day. So she's absolutely right that what you see, you need to see it.
Here you are, because Karen were together on the aortic task force, so I'm glad to have Karen there. But it's, another point to make, and there is a reason actually why I'm going to make this point, is that there are a lot of efforts regarding recruitment, and fair enough, because recruitment is important. 50% of the graduates in medical school are females, so we cannot really lose 50% of the talent. So we need to very aggressively look into the recruitment. But something that sometimes we put on the side is that recruit is one thing, but retention and promotion is another thing that is extremely important. And if you really want to recruit, you have to make sure that the people that you have already recruited, they can be up there and they have equal opportunities. I know that currently there is multiple women doing adult cardiac surgery that they're like mid-career people, more than 10 years out. And the question to me, and the amazing thing was always, what happened with these women, where they are? And this is something that we have as a society and as leaders, we have to look really very deep into it and say, where are the issues and what we can do to make things better. Because especially when we know what Karen said before, you do need to see people on the podium. In order to see people on the podium, in order to see women at leadership position, they need to get the opportunity. And that means that you need to have people believing in you. And beyond the mentorship, you need to have the sponsor and the champion. The sponsor and the champion are the ones that are going to give you the opportunities to move on, and they're going actually to vote for you. So there are like 3 levels. It's really the hiring, retention, recruitment, but really retention promotion is as equally as important as the recruitment.
So I can say at sort of the leadership levels of the society and at the American Board of Thoracic Surgery, there is not only an interest in doing that, there is a priority to do that. That, on behalf of kind of the old white guys, in the room.
There's only one.
The old white guy in there.
The only one, the only guy.
You're not old though. You're not old.
The only guy.
But there is, Doug Wood, who was one of my mentors back when I was in training. His presidential address at the STS was nicely paraphrased by Ourania. It was a call to action, and that important point of, look, if we can't attract women to cardiothoracic surgery, we're missing out on 50% or more of the talent pool. In order for our specialty to not just survive, but to prevail, we want all of the best and the brightest to not only want to be interested in cardiothoracic surgery, we want them to be successful in cardiothoracic surgery. And all the points that Ourania made are absolutely right. We need to be better at developing everyone in the training programs, in their early career, as they navigate academically, clinically, and in the societies. And just like it's hard to take somebody and make them a professor, it's a lot easier to identify someone early on and groom them and develop them and help them be, in the academic ranks to get promoted. Same thing too in the societies. That that the AATS, certainly the STS, these organizations, they're not ceremonial positions. It's the STS has assets of over $60 million. We have educational programs. We've got advocacy programs. We fund research. So it's getting in at the ground level, learning how these organizations work, and understanding how to contribute to the Society of Thoracic Surgeons. And I can assure you, by putting in the time and the effort, you will rapidly progress up into the leadership levels. And that is a priority for us. And I know that both Ourania and Karen are very actively involved. And I don't know, Ourania, Karen, can you talk about how in some of the organizations you've been embraced and supported or not?
No, I think actually over the years, definitely the societies have been much more inclusive, no question about it. Both Society of Thoracic Surgeons as well as the American Association for Thoracic Surgery. And the environment is changing, and I think there is definitely a change that starts from the top, with more visionary people coming and really promoting the diversity of thoughts. and diversity in leadership positions, and we see that, no question, and also, for the American Board of Thoracic Surgery as well. But I think this is a continuous, effort. There is definitely work to be done, and we have amazing mentors. Most of my mentors, they're male mentors, and I'm very honored to have them, and they have helped me all the way. At the same time, though, I would love to have early on female mentors, that they can tell me about the potential challenges that I could have, in my career, and what I can watch for, or what I can be more careful, or the things or pathways that I could potentially, follow. So just by looking back, even though I had wonderful mentors, most of them, again, were male mentors. So the lack of female mentorship was something that I missed. The camaraderie that I have right now with my fellow female cardiothoracic surgeons, I think it's extremely good. And in addition, and I think Karen also can talk about it, we have the Women in Thoracic Surgery organization. I think is very important for us. Represents all the women in thoracic surgery, cardiac surgery, and congenital surgery. That's important. And under the current leadership of Lauren Kane, the current president of the Women in Thoracic Surgery, they actually developed the 3 subgroups: the adult cardiac group, the thoracic, and the congenital. And I'm humbled and honored actually to represent the adult cardiac group. And the reason why this happened is because it was kind of dissociation and kind of misrepresentation of the how many women we have in leadership positions within the cardiothoracic arena. And again, seeing much, and I think Tom can actually say to that, much more women that they do in general thoracic getting into leadership positions comparing with the adult cardiac or the congenital arena, where we're really behind. And that was one of the reasons why Lauren Kane actually and the rest of the leadership within the Women in Thoracic Surgery decided to create these 3 different subgroups. It's more for us really to make significant work and see what can be done, so can be kind of equally represented and have equal opportunities.
So I think it is happening though, Rania. So Yolanda Colson, I mean, she is in line to be president of the AATS. Jenna Hirsch Romano, she's on the American Board of Thoracic Surgery. Yolanda was the exam chair for the American Board of Thoracic Surgery, and it's a little bit of a catch-22. It's hard to have women who are mentors when there are so few women in the specialty. But I do think that it is. There's a question that we have from the viewership, but I think it would be a mistake for women who are interested in surgery, in cardiothoracic surgery, to think that men aren't interested in being sponsors or mentors for women in the specialty.
Absolutely. I completely agree with that. I think we have great mentors and great male models that really promote, the equity and having women, no question about it. Because again, it's not about being a man or a woman. It's really about having a great specialty and having the talent there. This is what we need. So I completely agree. I mean, we have great people and great male and currently female role models. But what we need to create is, instead of having 1 or 2, we need to create what we call a critical mass of women getting into. By having 1 or 2 doesn't solve the problem. You need really the critical mass that really empower the base and you keep moving forward. And that's why I talked about the Women in Thoracic Surgery, because I think really had done like tremendous work of helping and promoting women as well.
So we have a few
I'm 5
questions.
years into my career, and certainly as I've made the transition from training to being an attending, I have certainly seen how sponsorship can advance your career, and I've benefited from the sponsorship of many men in the specialty, both at the University of Michigan, University of Pennsylvania, Mass General, but within the Society of Thoracic Surgeons. And I can see how much that's helped me develop over the past 5 years academically. And I've been nominated to workforces and task forces on the Society of Thoracic Surgeons. I serve on them with Ourania. So I agree with Tom that those opportunities are there for women, and sponsors are both male and female. With regard to Women in Thoracic Surgery, that's a special organization where we do have the opportunity to have fellow women, mentors, sponsors, comrades, and address some issues that may be specific to women in cardiac surgery and thoracic surgery, as well as congenital. One of the things that the Women in Thoracic Surgery is working on is helping to sponsor women by creating like a directory of women who are available to serve on committees as speakers, moderators, so that there are more women who are visible.
So on that note, Karen, we actually have a comment from the audience. First, thank you all for participating in this panel. Dr. MacGillivray and Karen were huge inspirations to me when I was a junior resident at MGH in my drive to pursue cardiac surgery. One of the most exciting aspects of women in CT surgery that I have seen is the ability to meet other women via social media platforms, as many times we may be the only women in our department. Can you speak to how to best leverage connections made across institutions to help promote not only retention in CT surgery, but also continued scholarly activities? I wonder who that is.
Well, I think that that's a great question, and I think that organizations like the Women in Thoracic Surgery can provide a center point for that to happen. And I think that that having like-minded people who understand what the issues are and how to address the issues and help solve them. I'm going to go out on a limb and say, you may think that the men in leadership positions in cardiothoracic surgery know what the obstacles are for women to come into cardiothoracic surgery. And I can tell you, if we knew what they were, we would have already solved them. We don't. Mm-hmm. We need your help. We need you to tell us what the issues are so we can help solve them together. I think
Absolutely.
that.
Well, the first step is always awareness, right?
Awareness,
Everybody, and we talked about this, like if you're not aware of the problem, and so our job as females in any field is to, give you that awareness to know what the problems are. Because like a lot of my role models are men that have helped me throughout my career, and so I can't be one of those women that oh damn the man, they're bringing me down, because they really haven't. And so my job is to shine light on the issues that I may be having that y'all may not be aware of.
Well,
So,
as an example, a few years ago, Shanda Blackman at the Mayo Clinic, she was at a board of directors meeting of the Society of Thoracic Surgeons, and she made the point that at the annual meeting there were no lactation stations. And, embarrassed to say, the guys, we weren't aware of it. Mm-hmm. It's not that we didn't have them, we just weren't aware of it. And as soon as we were made aware of it, we solved that problem literally with a stroke of a pen. Mm-hmm. And there are many issues that we just don't know exist. because as I said, I'll go back, we want the talent, we want the best and the brightest to come into cardiothoracic surgery. And we know that there are obstacles. I mean, you shouldn't have to choose between being a cardiothoracic surgeon and having a life, being a cardiothoracic surgeon and having a family, being a cardiothoracic surgeon and being academically productive. There are some things about all of our specialties that are hard. I mean, that's part of what attracts us to cardiac and vascular and thoracic surgery. I mean, to paraphrase Tom Hanks in A League of Their Own, of course it's hard. That's what makes it great. And the fact that we can do it well is what keeps us really in the specialty. But I do think that some of the issues that affect men to go into and be successful in cardiothoracic surgery are different from what the obstacles are for women. And if you help us be aware of them, we can help everybody overcome them.
Thank you to the person who said that comment. That's very nice. I think with regard to the question about community and connection, I think that there are a lot more opportunities to reach out via social media. There are organizations like Women in Thoracic Surgery as well as STS and AATS, but Twitter, you can and Rania is great on Twitter. I am not as in the know, but reaching out to somebody with a tweet or a direct message. There's Facebook. There's anybody who's interested, who's watching this. You can reach out to both me and Rania. We can and certainly there are many other women cardiac surgeons who want to know of your interest and help you and foster it. So I would say just don't be shy and connect.
And cardiothoracic surgery is a small specialty. I mean, it's a very small specialty, and for academic advancement, the Society of Thoracic Surgeons, the Thoracic Surgery Foundation, the AATS Foundation, they have monies to provide early careerists for research projects, whether they're basic science or outcomes. I mean, there are mechanisms and money in place to help people start in an academic career. There are people within our specialty who will help you, who want to help you be successful. Maybe that person or those people aren't at your institution, but they're at other institutions. And you can reach out and they will help you. They will show you the way, they'll shine the light on that way. And I think just making that overture, I think you will be very surprised to find out that there are a lot of people who will help you be successful.
Absolutely. To both, Karen and Tom's comment, especially these days with the social media, really provide the platform that you can really reach across borders. I mean, no matter where you are, and you can ask for advice. And I think it's not going to be one person that wouldn't like to help. Because multiple times we get, as Karen said, like a direct message, or somebody sent us an email and said, "Oh, we saw this and this. Can you please help us and direct us what we can do?" So it's a great platform to increase scholarship as well as to increase collaboration.
So it's getting close to 45 minutes, but we had a few questions that were some fun questions, okay? So if you weren't, just to have a little fun at the end, if you weren't in medicine, what would you be doing?
Me?
Well, everybody, all of y'all.
What do you think, Rania?
I would travel the world.
So you're independently wealthy,
Yeah.
I see.
No, I'm not, but just I like to just see new things, meet new people, and search, the hidden cultures. So I just love that.
Karen?
Gosh, if I had to pick another specialty within medicine.
Not in medicine. Not in medicine.
In medicine?
If you had to pick another
I think
career choice.
I would become involved in football.
Football.
I've become very interested in football. Maybe I can somehow go in that direction.
Tom?
Not playing football.
No, right.
I would like to have you as my football coach. That's good.
Yeah, the new general manager of the Marlins is a woman.
Mm-hmm. Is a woman. Yep.
Yeah. I mean, I've wanted to be a doctor since I was a kid, kind of taken after the role model of my father. But I don't know what I want to do. Maybe I'd like to say I'd be an athlete, but those days are long past. But I don't know. Maybe go into some kind of public service.
So, well, I guess that attests to the fact that they all love what you do, what y'all do, since you can't think of, imagine yourself doing anything else. I would be a homicide detective in New Orleans because I just love that. Palma?
You would be busy. You'd be busy.
I think my MBA is rubbing off on me. So I think I'd love to be a CEO. I want to be the boss, Kind of like Robert De Niro. I'm the boss.
Very nice.
That would be fun. Yeah.
All right. Well, great. Any last minute comments?
Any other questions, Linda? That
we had a second one, but it's sort of, let's see. How would you advise trainees to approach discussing these important points of sponsoring and advocating for women in cardiovascular surgery with their male faculty mentors and colleagues?
I think, as Tom has said, they're a lot more receptive than you think they might be.
Yeah.
And that is in regards to your training, but also personal aspects of training. You think that they wouldn't, but actually they're open. They're open to hearing about the issues and to helping you figure them out for you individually, and also the residency program. And I know this from experience at the University of Michigan. I think the residents do have a woman to look to for submission, but my male partners have all been equally receptive when I've talked to them and when residents have talked to them about training in cardiac surgery as a woman.
No, I agree with Karen. I mean, they're very, very, sometimes you think some people can be not receptive, but you'll be surprised actually how open they can be. And if you sit down and discuss how helpful it can be by providing advice. So I wouldn't really hesitate to ask for help or ask for mentorship or guidance all along, even if you are if you are like an early faculty or like mid-career faculty or even senior career faculty, it doesn't really matter. I mean, sometimes you'll be surprised that people actually, as Tom said, they don't know that there is an issue. And if you don't know that there is an issue, then you cannot really address it. So increase awareness, discussing issues, and the most important, finding solutions is really a key to move forward. And all of us, we do want the best for the patients. By the end of the day, it's not about being a woman or being in a man or something like that. It's really about having the best and the brightest and really providing the best care for the patient. By the end of it, it's really the patient that matters. And you want to have the best surgeon, you want to have the best clinician there. And this is really what makes our specialty great, that we're looking for the talent. We want to retain and recruit talent, and we want also to promote talent. And this is really what it matters.
Yeah, if anyone is interested in cardiothoracic surgery, if you're interested in being willing to work hard and take great care of patients, we are interested in you, and we will help you. And if there's not somebody at your institution, if you're at a place that doesn't have cardiothoracic surgery, call some other place. If you meet an obstacle or roadblock at your institution, call another institution. You know, get in touch with people at the STS or the AATS, and we will help direct you to somebody who can be helpful for you. Because we, as I said, this isn't just an interest, this is a priority to make sure that our specialty prevails.
All right, well, thank you for everyone's time. And thank you to the audience for participating and turning in your questions, and we'll see you in December.
Thank you.
Thank you.
Thanks,
Thank you.
everybody.
Holidays.
Thank you.